Hi, this is Dr. Priya Jagia. I am heading the Department of Cardiac CT and MRI, the cardiac imaging at AIIMS Delhi. So, I talked about cardiac MRI in heart failure. So, I will just summarize quickly where cardiac MR can help in patients with heart failure. The first and foremost is to differentiate in patients having myocardial dysfunction, whether it is because of ischemia or non-ischemia. In patients who have ischemic cardiomyopathy, cardiac MR can help by determining the viability, that is whether the patient will recover following revascularization or not. So, if there is increased scar burden or the transmurality of the infarct as seen on the late gadolinium enhancement images is more than 50%. So, if the scar thickness is more than 50%, the segment is less likely to be viable. And it has been shown that the LGE acts as a poor prognostic feature. So, presence of LGE, extent of LGE acts as a poor prognostic feature in patients with heart failure. Second use of cardiac MR in ischemic cardiomyopathy is in for stress studies, where it has been found to be superior to SPECT because of high spatial resolution. So, it can pick up areas with inducible ischemia. So, these are the patients who need revascularization. Besides this, we also have parametric mapping, which can help pick up myocardial edema, diffuse fibrosis, and can also pick up conditions of non-ischemic cardiography. So, in non-ischemic cardiomyopathy, cardiac MR can help take the clinician towards the etiological diagnosis depending on certain features. For example, if there is edema or subepicardial enhancement, a patient has got myocarditis, presence of granuloma again with edema, and typical enhancement will make a diagnosis of a sarcoid. Then in patients of restrictive cardiomyopathy, where echo cannot differentiate, or you have a query between CCP and RCM, here again cardiac MR is the investigation of choice to give you gold standard reference values for your myocardial function. Also, while the patient is on treatment, for follow-up, cardiac MR can be repeated. This is a study which is non-invasive, does not involve any radiation, so you can repeat it for the follow-ups also. Parametric imaging has made it possible to pick up diffuse myocarditis in patients who have got genetic cardiomyopathy or HCM. In those patients, for the follow-ups, cardiac MR can be used, and also for evaluating or do the family screening, cardiac MR can be used. So, cardiac MR is the investigation of choice whenever you have a patient of heart failure. For CCP, it is the investigation of choice to pick up pericardial thickness, the amount of constriction, and to differentiate from RCM. Again, valvular cardiomyopathy leading to heart failure could also be there. It can then supplement the data which is supplied by echo and can further help you in prognosticating the patient. Thank you.